Morning Liberty.
Well, what is up, all of our liberty-loving friends? This is another fantastic episode of Good Morning Liberty. My name is Nate Thurston. I'm by myself today, just me and the cats. 2 cats, specifically, 2 more upstairs. Charlie Thompson is not here today. He is gone all week, so it's just me again for the rest of the week. Today we're going to talk a little bit about healthcare, specifically Obamacare, because that's a fight that's involved in the government shutdown right now. So we're going to talk about that. If it is your first time listening, just be aware. Typically, it's myself and guy I've been best friends with for over 20 years now, going back and forth on stuff. So this is not what the show typically sounds like. You'll have to come back and listen next week or go and listen to some older episodes. We've got 1,644 episodes so far, so you have plenty of episodes to go and listen to. So the government's still shut down right now, which is cool. Totally fine with that. I'm becoming less and less convinced that we're going to get any of the cool stuff, like the massive furloughs, layoffs, firings, stuff like that. I don't know exactly how this is going to turn out, but there are some indications, since there is a big fight over Obamacare right now, that there could end up being a compromise. Specifically, what I think is most likely a compromise to extend some of the coverages for Obamacare at least past the midterm elections. That would be my initial guess. If I'm being very cynical about politics, that is what they would do. I saw an article in the Washington Post, seen a lot of stuff going around. I saw Senator Mike Lee posting about Obamacare this morning. Representative Andy Biggs, I believe, introduced something to repeal Obamacare this morning. I saw a clip from Jon Stewart going around where he's talking about, they're just asking for, healthcare coverage for all these Americans that are on it. And so I wanted to talk a little bit about the issue that we're dealing with healthcare, which is too expensive. The healthcare itself is too expensive. The health insurance itself is too expensive, which is a result of the healthcare itself being too expensive, and all of the mandates that came from the Affordable Care Act, thanks to Obama, which we call Obamacare. I'll start you off with this Washington Post article saying Trump hints at healthcare deal to end shutdown. Key hurdles remain. So I'm going to read a little bit of this today, and then there's also an interesting article out from the editorial board at the Washington Post talking about Obamacare specifically. President Donald Trump's pledge Monday that he's open to a healthcare compromise that could end the government shutdown has Democrats keen to make a deal and conservatives eager to blow it up. Quote, this is from Trump, "I'd like to see a deal made for great healthcare," Trump told reporters in the Oval Office on Monday, responding to questions about the Affordable Care Act subsidies set to expire at the end of the year. He later wrote on his Truth Social platform that no deal would be possible until Democrats agree to end the shutdown, which Democrats say they will not do without the agreement on the subsidies. What we're dealing with right now, and I'm going to get into some more details here in just a bit, is that during COVID, through the American Rescue Plan and then the Inflation Reduction Act, there was first an expansion of these subsidies through Obamacare, expansion of these coverages that ended up including millions more Americans. Those were set to expire at the end of 2022, I believe, but then they were extended with the Inflation Reduction Act until the end of 2025. So what we are dealing with right now with this potential compromise on ending the shutdown, and when you hear Democrats talking about Obamacare, what they're talking about is something that was temporary, needing to be made permanent or at least extended until we solve whatever the problem is. And isn't that just a shock to everyone listening right now, that there was something that we did during a crisis, during an emergency, this temporary expansion of a government program to help people during a crisis, and now we're sitting here, and the only way the Democrats want to end the government shutdown is if we can further expand or further extend those coverages that we decided to do during that crisis. meaning it's no longer temporary. It's going to be baked into the system. That happens over and over again. Republican lawmakers and White House aides on Monday acknowledged that they had considered theoretical compromises, such as an idea to grandfather in some ACA enrollees who received the subsidies, but maintained that no deal with Democrats would be possible until the shutdown ends. So they're saying, yeah, we'll talk about it, but we got to end the shutdown first. Democrats are saying, well, in order to end this shutdown, you're going to have to make this compromise. And that's exactly, that's pretty much where they are right now. GOP leaders also were targeting what are known as zero premium plans, arguing that some insurance brokers have taken advantage of the expanded subsidies to wrongly enroll Americans in fully subsidized plans that represent a disproportionate share of fraud and abuse. Now, they always have to talk about fraud and abuse, something else I'm going to go into a little bit more later, because they can't just say, we shouldn't be paying for this stuff. Like, it's not that guy's job to pay to subsidize your insurance plan. It's costing us a ton of money, and we need to stop doing it. They have to say, well, there's tons of fraud and abuse, so we have to go after that. Because who's in favor of fraud and abuse? Not a lot of people are like, yeah, fraud and abuse, that sounds awesome. But a lot of people are in favor of the government subsidizing people's health insurance premiums. So you gotta frame it as fraud and abuse always. Conservatives further cautioned against interpreting Trump's comments as willingness to build on the ACA, a program he's long criticized. Quote, the president didn't say he wanted to permanently extend the COVID credits, said Executive Vice President of the Economic Policy Innovation Center. I like that she said to permanently extend the COVID credits. I believe that. I don't think he wants to permanently extend those credits. I still think that the most likely thing is that they'll do a temporary extension until the end of next year, potentially. Maybe the year after that. You know, if you're going towards an election, you don't want to have that hanging over the election really at all. Like, oh, if you don't vote for us, you're going to lose these tax credits, these subsidies here at the end of the year. So you want to vote for us so we can keep these subsidies going. You want to push it off a little bit further in people's minds so it's not this immediate problem. So I guess I would say instead of at the end of next year, maybe the end of the following year. That way it's not immediate. I will amend my prediction for that. So this morning, as I said, what kind of kicked all this off in my mind is there's been a lot of people talking about Obamacare. And I saw this in the Washington Post article. There's another Washington Post editorial board piece that's going around, getting reposted all over the place. So Representative Andy Biggs says the reality is that Obamacare is only affordable when it's heavily subsidized. The complete failure of the Affordable Care Act is why health insurance premiums have skyrocketed. I was right about that. I mean, I'm going to go over some stuff, and I've done this. I don't know how many episodes we've done talking about this, but we got a little bit more new information now, so we'll cover some of it again. Would be better if Charlie were here for this, but I'll try and remember everything. Senator Mike Lee reposted, healthcare will keep getting more expensive until we repeal Obamacare. So Congress should repeal Obamacare. Republicans ran on this for a decade. We shouldn't run from it now. Pass this on if you agree. Well, I do agree with that. And as many of you might remember, when Republicans didn't have the power to really do anything, they voted multiple times to repeal Obamacare. I don't know how many times it actually was, but multiple is the actual amount of times. But then when they get into power where their votes would actually matter, they don't do it. Why? Because no one really has a backup plan for how we're going to fix the healthcare problem in the U.S. Like, health insurance is really expensive. It's more expensive because of Obamacare. We'll go over that in a second. But it's paying for something. What's it paying for? It's paying for actual medical care. The medical care itself is very expensive. Many of these things are way more expensive than they should be. And a lot of that is still the fault of the government. So let me get to what changed during COVID and what Democrats are wanting to keep and what Republicans might end up compromising on. So they have this system where when you go onto the exchange, the amount that you pay could be determined based on your income level, your income in relation to the federal poverty line. And so if you're less than 150% of the federal poverty line, you would pay 2.2 to 4% of the cost or of your income, towards whatever your premium is. So here's what the premium is for the healthcare. This is what the plan costs as the annual plan. And what you would pay in towards it is capped at between 2 and 4% of your income. Now, if it's more expensive than 2 to 4% of your income, guess who picks up the rest of that? The government, which is you, everyone out there who pays taxes, including the person who's getting the subsidy probably, and any taxes that they end up paying. The next level up is 4 to 6.3%. Next level is 6.3 to 8.5. Then we got 8.5, and then 8.5 to 9.5. And then if you make over 400%, now this is before the COVID era, if you make over 400% of the federal poverty line, you don't get any subsidy. You can buy something on there, but it's not going to be subsidized at all. So what changed with the American Rescue Plan and this temporary thing that happened for Obamacare during the American Rescue Plan was those people at the bottom, the less than 150% of the federal poverty line, it's no longer capped at 2 to 4% of your income. Now it's 0%. You just get fully subsidized. You don't have to pay any of it. The government's going to pay the whole thing, okay? All of these rates were essentially cut in half to more than cut in half. I would say more like a 60% reduction for some of these things. And then on top of that, where they had that cap with people who make more than 400% of the federal poverty line, they released that. You can make more than 400% of the federal poverty line, and you can still get a subsidy. And that subsidy is capped at 8.5% of your income. You're not going to pay more than 8.5% of your income for that health insurance. So a lot of people, like a lot of middle class people, ended up being able to get in there and get coverage and get some of it subsidized, where beforehand they weren't able to do that. And this, by the way, cost a lot of money, as you might imagine. I saw this chart going around, saw it reposted several times today. If you're watching on YouTube or watching in the Fed Haters Club, join gmail.com. You can see this chart on your screen right now. Let me just make it full screen right there. This chart goes from 2013 up to 2026. 2026 hasn't happened yet, so a little bit of projection there. But beforehand, what you'll see, there's different colors on the chart, by the way. I'm going to try and explain this for people that are listening. You'll see orange is the enrollee. That's you getting on the exchange. Like, what share are you going to pay? And then there's COVID credits that kick in 2021. And then there's the dark blue, which is the government's share of the premium. So what you see is that the premiums have gone up quite a lot. In 2013, the number was just over 3,000, and for 2026, they have this projected at 10,000. That's a fairly decent increase right there. But the really big part that you see here is that starting in 2014, you see that the enrollee is paying 31% of that cost, and then the government's paying 68% of that cost. And then the amount that the enrollees are paying goes up slightly over this 10-year period, like slightly over the 10-year period. But the amount that the government is paying is just skyrocketing over that time, more than doubling over that time. And so for a government that is essentially bankrupt, not really bankrupt, but very close, and 37 point something trillion dollars in debt, like this creates some issues. All right. It also creates issues in the health insurance market itself. It also creates a lot of issues in the market for medical care itself. Like, when you remove it from healthcare for a second, what do we know about what happens when the government covers the cost of college, or they allow anyone to get a loan for almost any amount for college? What happens to the cost of college at that time? You probably would guess it would go up. Do you hear any reason in the scenario I just laid out for why the cost of college would ever go down during that time? No, you didn't hear any reason that it would go down at all. You would only hear a reason that it would go up. Now, it doesn't have to go up really, except for you're covering college for everyone to pay almost any amount, and supply and demand would dictate that it starts to go up. But why would they ever decrease the cost? There's no reason to decrease the cost. Likewise, when you come in and you subsidize health insurance, why would it go down? Why would it get cheaper for people? And then when more people are getting this health insurance and you're using a third-party payer paying out of a large pool of money to pay for every single little thing you could have healthcare related, like, why would that cost go down? What's really missing here is any downward pricing pressure on health insurance, and then in connection to that, the actual market for healthcare itself. The hospital knows that, well, the insurance has to cover all of these things. They have to insure everyone. The government is subsidizing many of these plans. Like, where is the downward pricing pressure in the market? Where's the competition really in that market? There isn't any. It just keeps going up and up because there's no reason for it to go down, and supply and demand would say there's no reason for it to stay the same either. And that is what we are dealing with right now. Just general market dynamics that the government is trying to control, but they're actually making everything worse. Now, there's this opinion piece by the editorial board at the Washington Post. This is where I have to mention that people are throwing around screenshots saying that even the Washington Post is now admitting that this is a problem. Typically editorial boards, and especially with the changes that the Washington Post made, I wouldn't say right-leaning, but they're not like hard leftists or anything. There's not like a ton of Marxists on there or something like that. And so it's not exactly the Washington Post and all of their journalists having like a come to Jesus moment on how terrible Obamacare was, but it's great to see these things posted in the Washington Post regardless. So this one's called The Shutdown Conversation No One Wants. This is a short piece, and I'm going to read you almost all of it. It's like 6 paragraphs, but it explains a lot of really good things here. As the partial government shutdown enters its second week, neither party is leveling with the American people about the hard choices required to get federal spending off a fiscally ruinous trajectory. Now, that's one of the truest paragraphs or sentences that has ever occurred in Washington Post history. Right there. Neither party is leveling with the American people about the hard choices required to get off of this fiscally ruinous trajectory. President Joe Biden and Democrats use COVID-19 to justify chasing the mirage of a European-style welfare state without raising the necessary taxes to pay for it. Now, prodded by the left, party leaders have shut down the government in a bid to permanently extend what was sold in 2021 as emergency subsidies to help people struggling during the pandemic afford health insurance. Nothing so permanent as a temporary government program. That seems to always be the case. Thank you, Milton Friedman, for that great quote. President Donald Trump and congressional Republicans were eager to extend tax cuts when they regained control of government, but they were unwilling to make deep enough cuts to pay for them. That's how you can tell it's not like a crazy right-winger libertarian writing this, is when they talk about paying for tax cuts. But whatever. The bill Trump signed on July 4th will reduce spending by $1.1 trillion over the next decade relative to what they were going to spend. But that is more than offset by $4.5 trillion of tax cuts that will do little for growth. The national debt stands at $37.9 trillion. I didn't realize it was that high. It's pretty crazy. A figure that dwarfs the annual gross domestic product of every other country. It has grown dramatically since the pandemic. In the 2019 fiscal year, the federal government spent $5.4 trillion, but took in only $4.2 trillion. 5 years later, spending clocked in at $6.75 trillion, as revenue has failed to keep up with that expansion. That's all stuff that we've talked about before. Okay. Democrats have demanded that Republicans agree to extend the COVID-era insurance subsidies without proposing any way to pay for it. The CBO estimates this will cost $350 billion over the next decade. These temporary benefits were included in the American Rescue Plan of March 2021 and extended the next year in the misnamed Inflation Reduction Act until the end of 2025. And this is the part that's been going around the Twitter sphere right now. The real problem is that the Affordable Care Act was never actually affordable. President Barack Obama's signature achievement allowed people to buy insurance on marketplaces with subsidies based on their income. The architects of the program assumed that risk pools would be bigger than they turned out to be. As a result, policies cost more than expected. Now, one thing about this is that we used to have the individual mandate in Obamacare, which I would never agree with. You would never mandate that someone purchase a product. I'm against the entire thing. But if you were fine getting past the idea that you're going to force people to buy a product and you were trying to design a government-subsidized insurance system that would at least have a chance of working for a little bit longer, you would want to have an individual mandate because you would want as many people paying into that risk pool as possible. This is actually how you can keep some of the costs down because you're going to have healthy people who don't need the insurance paying into the risk pool. And so even though you should fully disagree with mandating that people buy health insurance, or mandating that people buy any product whatsoever, you can't at least understand the rationale, the reasoning behind why they would do that. It does, if you're going to do that, it makes a little bit of sense. I hate saying that. I really hate saying that. To salvage the program, Democrats expanded subsidies to entice more people to buy plans. So instead of forcing people to buy plans, they decided they were going to expand the subsidies to get more people to come into these risk pools. Many poor families wound up getting insurance for free, and the rolls grew. 24 million people now have. So what happened is, they made that 0% of your income that you have to pay towards the insurance. Yeah, a whole bunch of people jumped on that, didn't they? 24 million people now have coverage through the ACA exchanges. People earning more than 400% of the poverty line would see their subsidies go away if this thing actually ends at the end of the year like it's supposed to. Democrats picked this fight because they see healthcare as a winning issue. A post poll conducted on the first day of the shutdown found that 71% of Americans say federal insurance subsidies should be extended, while 29% say they should end as scheduled. Just as significantly, the question divides Republicans. 38% support extending the subsidies, 62% want them to end. So when you say 71% of Americans say that these insurance subsidies should be extended, 71%. Earlier, when I mentioned that they have to frame this as going after waste, fraud, and abuse when it comes to Obamacare, it's because overwhelmingly, the American people are like, yeah, I would like you to keep subsidizing my insurance. That stuff is really expensive. So I want you to keep doing that. And so coming out and saying, no, I'm not going to do that. That's ridiculous. Pay for your own stuff. Come on. You're an adult. They have to say, well, there's a lot of fraud and abuse in that program. And so we got to find ways to go after that, which they should do. But also, I think people should come right out and say it. It's not that guy's job to pay for your stuff. It's that simple. How's it my job to pay for your stuff? It's not. That's ridiculous, isn't it? I like this paragraph right here, too. They say, this is how entitlement programs work. Once you habituate people to some generous government handout, they grow dependent on it. And it becomes politically perilous, if not impossible, to fully claw it back. Conservatives fought so hard to stop Obamacare 15 years ago because they anticipated fights like this one. Because once you give people this handout, once you create this subsidy, it's so hard to take it back. And I want to add on top of this, they grow dependent on it. That's what this paragraph says. It's not just the people that grow dependent on it. Like they become accustomed to that. They're used to getting that subsidy. They want to pay that extra amount. The market itself becomes dependent on it. The market itself adjusts to those increased premiums, which are increasingly paid for more and more by more subsidies from the government. But they don't care. The premiums can keep going up. So the health insurance companies get used to that. They don't have to worry about so much about how much people are paying in these premiums. They're getting a whole lot of subsidies from the government. And then likewise, the medical providers get accustomed to it as well. As these third-party payers are paying more and more, the cost of everything keeps going up and up. The hospitals, medical providers can raise their costs. The insurance companies have to cover anyone that wants to get insurance. They have to cover these things. And so where's the downward pricing pressure? The overall market adjusts to this pricing. That's one of the other reasons it is so hard to fix the healthcare problem. Because when you look at health insurance companies, they don't make a ton of money. Let me rephrase that. They make a ton of money, but they don't make a large profit percentage. It's on a large scale, so it's technically a ton of money. But they don't make a large profit percentage. These companies that people hate so much, like United Healthcare, my guess, or I haven't looked at this figure in quite some time. My guess is it's around 4%, and that might be too much. People be like, oh, well, they pay their CEO this much and this much. Like you're talking hundreds of billions or tens of billions versus like a guy getting paid $20 million. The fraction is not enough to adjust to affect what their net margins are at all. And so, like, there's a guy who works in the healthcare field here in the group right now, and that's the other thing. So he says we aren't getting paid more. The interesting thing that happens, and I'm glad you said that because that really helps on this point. The hospital corporations, the healthcare corporations, they're not making massive margins either. Last time I looked at HCA, which I believe owns the most amount of hospitals out of any corporation in the world, last time I looked at their profit margin, it was somewhere around 8 to 10% is what they're actually making off of things. They're large hospitals in Nashville. I'm close to someone who does finances for this company. Not going to tell you who. She was like, they only collected 17% of what they billed out last year. Like, there's a big issue. I can't go fully into that whole thing. But yeah, it's not exactly that everyone's just getting paid more and more either. What happens in these markets is, I gotta find a way to explain this. Everyone here, most of you guys understand this. This is for maybe some people that are newer to thinking about economics. But, you know, if I got a bunch of Austrian economic majors out there, they're going to know. The market itself adjusts to that cost, and it doesn't mean that they're making a ton of money. Like, the products themselves become more expensive. The resources themselves cost more money as the amount of money available for those things goes up. So it's not as if I need wood for this table. The wood for this table costs 50 cents. There's a whole bunch of tables, and you got to pay the people to cut it down, pay the people at the mills to do all that, and make it into the wood that I can use for this table. And the whole thing's just going to cost 50 cents, and that's fine. Well, if all of a sudden the government comes in and is like, well, we're going to pay like up to $5 for that wood because we don't want you to have to pay for that anymore. And then everyone's like, okay, well, it's 50 cents, right? So we're going to make an extra $4.50 off that whole exchange, right? What actually ends up happening is they've got more money available to pay the guy that's cutting it down. They got more money to that guy. He's got more money available to pay for the equipment that's used to cut it down. You got more money for all the wages for all the other people involved. You got more money for the factory it has to go through and all of that. And all of those prices adjust to it being more expensive. And so as you keep increasing the available money for paying for a thing, it's not like there's just more and more profit margin on top of it. All of those costs will increase from the bottom up. And that is the issue that we have in healthcare right now. It's not exactly that things are getting more expensive and everyone is making so much more money. Things are getting more expensive and the actual underlying costs are getting more expensive because there's more money available to pay for them. And so it looks like we still got these 10% profit margins. Well, the underlying cost of what the hospitals have paid for has gone up so much at the same time. I did a terrible job explaining that, but that's why it's so difficult to ratchet this back. Because if you're like, oh, let's go back to paying 50% less for healthcare. all these hospitals will be like, we can't do that. That's impossible. We're making 10% margins on this stuff. How would we possibly decrease what healthcare costs by 50%? It's physically not possible. It's because the underlying cost of all these things has just continued to go up and up over that amount of time. Inflation, yeah, it's a good way of saying inflation. Thanks, Bailey. I appreciate that. Another thing here, in the CBS YouGov poll released Sunday, only 9% identified government spending as the most important issue facing the country. Only 9% identified government spending as the most important issue facing the country. Meanwhile, something I'm not even going to talk about today, like something like Social Security is like, it's dead by 2033. Like, they're going to find a way to keep it going. They'll find a way to do it. But my God, the deficits, the borrowing, the inflation that's going to come from what they are going to do, the increased taxes that are going to come from what they're going to do to keep Social Security going. Like, that date is going to happen. That year is going to happen, and probably it'll be out of money even sooner than that, I would guess. That's going to happen. What is that? That's 8 years from now. The next president, after Trump is out of office, if they don't have some kind of major Social Security reform legislation to fix the problem, when the next guy or gal comes in, they're going to be starting in the year that Social Security dies. It's going to happen. So, and they're like mandated to pay it out, you know. They're going to pay it out. They're just going to print it. It's going to cause more inflation, which is going to create more cost of living adjustments to what they pay out for Social Security, which is going to create more inflation. That's going to happen. But 9% of the country identifies government spending as the most important issue facing the country. So why would anyone be worried, given that both parties have effectively disassociated spending from revenue? The likeliest outcome of the shutdown is that both sides agree to spend more money without paying for it, let alone being honest with voters about the trade-offs too many have ignored for long. So this is something that I posted out on X earlier. As I explained earlier, I keep seeing people post about, we're just trying to save healthcare for Americans. We're just trying to protect healthcare for Americans. All these millions of people on the Obamacare exchanges, they're going to see what they're paying towards their premiums double. I showed you those percentages at the beginning of the episode. They were cut by 50 to 60%, depending on the income bracket, from the American Rescue Plan, a temporary program to help people during a time of crisis in our country. And what they're paying for their premiums is going to double. And no one wants to be the person that is in office when that happens. You're going to get blamed for it. You're going to get blamed for not deciding to extend a temporary program which they have no way of paying for. And even if you said, oh yeah, more taxes, none of the people want to pay higher taxes to pay for it. They just want it. That's all they know. And all they really know is that health insurance is so expensive and kind of sucks. Like, since Obamacare, we got higher premiums, higher deductibles. My God, I used to be so cheap. Now, my wife works for HCA. That's a spoiler for earlier when I wasn't going to tell you who I was talking about. And we used to get like this Cadillac plan that was like nothing. It was like nothing per month, essentially, is what it was. And then it went up to like $220 per month. I remember complaining about that, or my wife was complaining about that to some friends, and we were like, it went from $20 to $220 for a worse plan. And they were like, you're paying $220? We're paying like $2,000. So anyway, I can't speak too much on just get a job at a healthcare company. That's what everyone should do. That's how you get cheaper health insurance. That's the way to do it. I keep seeing everyone talk about how they're going to protect this for people, but no one is talking about the underlying problem. There's two really big underlying problems when it comes to health insurance. The first one for health insurance is Obamacare. Obamacare looks like itself like it was designed to destroy health insurance. If you were to come up with a way to not outlaw health insurance, but to create a program that would destroy it within 10 to 20 years, where people were left with no other option but to create some kind of Medicare for all system from the government, you would have created something that looks like Obamacare. That's what everything it does is designed to make health insurance more expensive and then subsidize everything it does to make it more expensive with the government using taxpayer money or borrowed or printed inflation funding money. That's exactly what it's designed to do. And all the people, I remember back during that time, I was probably listening to like Rush Limbaugh or something, or Mark Levin or Sean Hannity. And some of these guys had it right. They were like, this system is designed to push us to single payer Medicare for all. I think I just went into a Mark Levin thing. That's what happened right there. I guess I used to listen to him a lot. And they were right about that. It's exactly what it looks like. So I posted this out earlier. So as I'm reading this is me, what I typed out earlier, which is a good outline of what I wanted to say. So a lot of people are talking about protecting our healthcare when they actually mean taxpayer subsidies for terrible health insurance that's paying for overpriced healthcare costs. And almost no one is talking about the root cause, which is the cost of medical care itself. Remember, health insurance is paying for something. What is it paying for? Something that is extremely expensive. And guess what? Subsidizing insurance only incentivizes the cost of medical care to increase. You're relying on third-party payment out of large pools of money for every little thing, and that only pushes the price of that underlying service even higher. We've talked about it before. I've shown the graphs, like here's how many people used to pay out of pocket for whatever health care they were getting. And here's how many people are using a third-party payer of some sort. And now, way more people are using that third-party payer, much smaller portion of people actually paying out of pocket for anything, which I get it. It's so expensive. Like, how are you going to pay out of pocket for most of this stuff? But there's a difference in you as a business needing to charge an individual that comes in for a service and needing to think about your pricing in a way that person, or at least a significant percentage of people that come through the door, could actually pay for the service that you're offering. Versus everyone who walks in the door has got a card that says they have a right to this gigantic pool of money pulled together that a million people are all chipping in their money into this pool of money. And now instead of drawing that off of their debit or credit card, you're going to draw it off of their insurance card, which is pulling out of that gigantic pool of money so they can definitely pay for whatever that service is. It's no wonder that the cost of healthcare would just continuously increase. Why would it ever go down? I've said that many times already in this episode. For what reason would the cost of healthcare go down? There are no downward pricing pressures in this market at all. Obamacare made this problem worse. Here's a few reasons why. You've heard me talk about these before, but I'll do some of them again. Obamacare mandated that all individual plans and small group plans cover a list of essential health benefits, EHBs. So that's maternity care, and there's ridiculous things that you've heard people mention that it makes you all pay for. But they determine what these essential health benefits are, and every single plan that they sell has to cover all of those things. So no longer can a young, healthy person buy a cheap plan for any kind of catastrophic circumstance that arises. You used to call those catastrophic plans. That removes, among other things, by the way, I just put this in there as an example. It removes a cheaper option from the market. Those other plans, like, I know it's a stripped down catastrophic plan, but it's on the page. Like, imagine you're choosing between Wi-Fi plans or something. Like, we could give you 80 megabytes a second for this amount. Or we could give you a gig or 2 gig or 3 gig or whatever. But when people see that on the page, there's like a frame of reference there for like, what could I get? What is a very cheap option that I could buy right now? Okay, well that's like $40 a month right there. Or I could pay, the $100 a month for these other plans. But in the back of your mind, you're like, well, I could pay 40. I do have this option right now. And when they're doing those pricing structures, they have to remember that cheaper option is right next to it. And people might choose that cheaper option. that mechanism itself of the cheaper option existing, the catastrophically cheaper option existing, creates a downward pricing pressure on all the other plans that are listed on the page right next to it. It's not a giant pricing pressure because the plans are so vastly different, but just that right there is one little bit of downward pricing pressure on those plans. It's gone. You don't have that, okay? It's like if you put an analogy in here or whatever. You go to the grocery store, you're looking for soup. I don't know why it's always soup when you're talking about growth. I don't know how many people buy soup all the time. I don't buy soup. Not a fan of soup, honestly. You're going to buy this can of Campbell's tomato soup. You just want tomato soup. You got the Campbell's there. You got whatever this newfangled, organic tomato soup is. It's probably got a flat, non-glossy label on it. It's probably like a tan and green label with like a sprout on the side of it or something. For the organic one, it's expensive. And then you got like your great value tomato soup right there. It's like 3 cents. They almost want to pay you to take it. And like those are your options right there. And so when you go to buy the more expensive stuff, you say, well, I could get that one. It's cheaper. How about that? But maybe you decide to get the other one because it's nicer. But those nicer ones have to remember, well, there's going to be a cheaper option that is technically, legally tomato soup right there next to it. So we got to keep that in mind when we're pricing this super expensive soup. All right. So I didn't expect to spend so much time on soup. But Obamacare mandates that insurers can no longer deny coverage or at the very least charge higher premiums for pre-existing conditions. Now, I know that talking about denial of coverage for pre-existing conditions is very difficult. We don't know exactly what all the options are for that. But when you're talking about something that a business that is called insurance is going to offer, all I'm saying is, when you're talking about something that a business called insurance is going to offer, voluntarily taking on someone that you know for a fact you will lose money on, that's not a good idea. And that's not insurance. It's not. Call it something else. Just call it a mandate that I pay for your healthcare costs, but don't call it insurance. The whole problem, a massive problem with Obamacare, is that they acted like it's not something called insurance. They acted like these are companies that we are going to mandate to pay for your healthcare costs. On the name, it says insurance somewhere, but we're not going to talk about insurance models. It's not important. Or at the very least, not just denial. Charge higher premiums for the pre-existing conditions. Now, maybe if someone's going to cost you $1 million in the payouts that year because they've got some kind of terrible disease or whatever, not saying that you're going to charge that person $1 million. Maybe you're going to charge them a lot more. And that's one way to help cover that cost. But now you got to charge them what you charge everyone else. You can't deny them. And there are certain percentages, but you can't charge them higher because they have pre-existing conditions. So what ends up happening? Because you almost, like I said, there's different percentages that they have to work in with these community rating rules and all of that. There's a little bit of wiggle room. You almost have to charge everyone the same amount, whether they're super healthy or whether they're super unhealthy. You almost have to charge all of them the same amount. And so when you can't charge the riskier person a higher amount of money, a much higher amount of money that's closer to the amount of money you know that they're going to be costing you, what do? You raise the cost of all of the premiums. That is exactly what you do. You have to average all of that in instead of allowing people that are super healthy that you think are very low risk and they can get on here and they can pay into the risk pool. Instead of allowing that to happen, you got to average together all of those costs that you think these people are going to cost you, and you charge them all the same premium. So the people that are hardly using the insurance are essentially subsidizing the people that are using the insurance every week. Now, like, what do you do for people that you know are going to use that? That's a topic for another day. Right now, I want to talk about how Obamacare has ruined this. Right now, we're talking about a business called insurance and why it's not able to be cheap or as cheap as it could be. This is a design for some reason inside of Obamacare, for whatever reason. They require insurers to guarantee issue of coverage to any person, regardless of their health status, at any time during the year. So you don't have insurance. You want to come on, hey, need insurance, need to get it from the exchange. They still have these enrollment periods, but it's way more open. You'd be able to get some kind of coverage during the year. At least that used to be the case, unless that changed at some point in time. I don't think it did. So we had these things called like open enrollment periods. There's a reason. You want to create a scarcity almost. Like, this is the time that you can get our plan. If you come to us outside of this time, without, you got to have some kind of major life event. If you got divorced or you got fired or something like that, like, okay. If you come to us any other reason, just switching your plan around or whatever, outside of this time, we're not going to you got to wait for this open enrollment time. Okay. So people come in and they buy it and then they carry it throughout the year. What happens when you can get it at any time for almost any reason? You'll wait until you need it. They can't deny you for a pre-existing condition. They can't charge you an insane amount more for your pre-existing condition. So why would you pay into the insurance risk pool all year when they have to give you coverage whenever you need it? And they can't deny you for a pre-existing condition, and they can't charge you a lot more for having a pre-existing condition either. So now you have less and less healthy people that are just paying into the insurance system all year. I get it. It sucks, but that's what insurance is. You hope you never have to use it. But that's what insurance is. That's how that whole system works. Except for if people can just wait until the day before they need it to go on there and get that coverage. So what happens? You got to raise the price of everyone who is paying for the thing. You got to raise the price for everyone who needs that thing, because you're no longer getting the healthy people who aren't using your service, that are just paying all year and never using the thing. There's all sorts of other stuff. I mentioned the community rating thing earlier. There's medical loss ratio requirements. There's rate reviews. Like, they have to, when they change their rates, they got to get that approved by governments. Sometimes it can take a really long time to get it approved. And then what you asked for 2 years ago for your rate increase is not enough anymore. So you might as well ask for a bigger rate increase, way bigger rate increase, and permission from the government for that, because it might take a really long time for them to approve your rate increases. So just in case it takes too long, or just in case there's a bunch of inflation that happens, or just in case there's a pandemic or something like that, let's ask for way bigger rate increases than what we otherwise would have asked for, when we could just freely adjust the rates at any time of our choosing. Like I said earlier, it is like Obamacare was specifically designed to destroy health insurance, to push everyone on to some kind of government plan. Maybe it was. I'm not sure. But all of those mandates for coverage for everything, not being able to deny or charge higher prices for pre-existing conditions, the community rating as well, they've taken away all the downward pricing pressures. So in my opinion, before you're going to talk about how do we get the cost of the actual medical care itself to go down, you've got to tackle the cost of what everyone is using to pay for the medical care itself. And first thing you would do is you would stop subsidizing it. There's not a thing that we subsidize that doesn't get more expensive. The underlying getting more expensive. Now, they might subsidize a higher and higher percentage as more time goes on, so it looks like to you it's not getting more expensive, but it is getting more expensive. And they are paying out more money. And that underlying cost of the medical care itself is growing more and more every single year. There's no downward pricing pressure at all. So that insurance system, which is allowing the prices to just continue to increase, has to be fixed first off. And that's through repealing Obamacare. First off. Now, the problem is, before Obamacare, we didn't have a free market health insurance system. Hadn't had one for minimum 60 years before that, maybe even 100. Because you'd have to go back to the early 1900s to when the government first started meddling in health insurance. And probably since close to its inception, it has not been allowed to operate inside of a free market. And then we get to this point, and then people somehow blame the free market, which makes no sense because there isn't one at all, not even close, like one of the least free markets that there is in the United States. And then they say, well, the only answer here is for the government to pay for something. And when they say the government needs to pay for something, they're saying that you need to pay for it. They think that they're not paying for it. That's all I got today. I didn't expect to go for 50 minutes, but I did go for 50 minutes. That's fine. I'm sure I forgot many things that I planned on saying today. We will cover them some other time. I have a ton of things pulled up in here that I was going to talk about today. I decided, we went live at 9:30 Central. I decided at 9 that I was going to talk about Obamacare today. And so I left like the other 30 tabs that I had saved for tomorrow, I guess. So that's what I got. Thank you guys so much for hanging out. If you got any questions on this stuff, best place to ask us those questions would be on X, Good AM Liberty. I will see that. No guarantee I'll respond, but I will actually see that. Or you can send me an email. Wait 7 to 10 business days for a response. That 7 to 10 business days starts a week after you send the email. 7 to 10 business days after I've seen it. For a response, Nate@goodmorningliberty.us. You can do that. Join gmail.com, gets you in the Fed Haters Club where you can chat with us live during the show. That's another good way to talk to us. GodHatesFeds.com. You can go there and get yourself a cool God Hates Feds t-shirt. And what else am I missing? Leave a rating and review. Make sure you subscribe on YouTube. If you're watching this on YouTube right now and you happen to have not subscribed, hit the bell, whatever I think there's a bell. There used to be a bell one time. I don't know if it's still there. All right. If you do all of those things, and I mean every single gall darn one of them, I'll be right back here again tomorrow. Same Liberty time, which is whenever we want. Same Liberty place, which is right here in the Fed Haters Club. Until then, have a good day and a good morning, Liberty.